Hi, my name is Vivian C. Turn. I'll be doing the skills video administration of ophthalmic medication. I'm wearing the correct uniform. I have my badge. My supplies are 2 washcloth, 2 pairs of gloves, my Tomalol, and I have paper towels instead of tissue. I just don't have tissues, so my substitute for tissues is paper towel. Also, as a note, every time I move, my chair squeaks. It's kind of unavoidable. It's just something to note. So now that I've covered my bases, the first thing we're going to do is verify the provider's order. We're then going to verify the 6 rights of medication administration, which is the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. We're then going to check the medication order in the EHR. We're then going to check the medication against the order. So our medication is Tomalol 0.25% solution, 3.4 milligrams per milliliter. For this particular patient, he's been prescribed 1 drop per eye twice a day. Now that I've verified the medication against the MAR, that's the first time. We have to do it 3 times in total, and then we can administer the medication to the patient. So now that I've verified all my supplies, I'm going to take my supplies to my patient's door, knock on my patient's door, enter the room, close my patient's door, close my patient's curtains to ensure patient privacy. I'm going to put my supplies down on a flat, dry, clean surface. I am then going to perform hand hygiene, and then I'm going to introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth? I'm then going to check his wristband for 2 patient verification. It is the correct patient. Okay, Mr. Smith, are you allergic to any food, medication, or environmental factors? No? Perfect. Give me 1 moment. So I'm going to check the medication against the MAR again, and it is the correct medication. I'm now going to explain to Mr. Smith what this medication is used for. Okay, Mr. Smith, you've been prescribed Tomalol. Tomalol is supposed to help with your glaucoma. What it is it is a beta blocker. It's supposed to alleviate the pressures in your eyes. Some of the common side effects are light sensitivity. You can have light sensitivity or slight headaches, or you can have blurred vision. Now, if these happen, if they worsen or they persist, please let me know. If you administer this medication at home to your eyes and you experience these symptoms, please do not drive vehicles, do not drive any cars, do not operate any machinery. These can cause some damage. It can be a problem if you do that. So please wait until the symptoms are gone. Some adverse side effects that you can have are adverse, meaning you absolutely do not want these things to happen. Adverse side effects are shortness of breath, chest pain, or swelling. Swelling could be local or systemic. Local is in one area, systemic means all over or gradually going to the other body parts. Now, if this happens, you have to notify me as soon as possible, and I'll notify your provider. Another thing that other patients have reported is that when they use this medication, they report stinging or burning sensations of the eye. Yeah, I know, not very great. Do you have any questions for me? No? Okay. So I'm going to check the medication for the 3rd time. It is the correct medication. So we are now going to administer the medication to Mr. Smith. So I'm going to perform hand hygiene, and then I'm going to don clean gloves. Don clean gloves. Okay. Mr. Smith, I've noticed some crusts on your eyes. So what we are going to do is we are going to take this damp, warm washcloth, and we're going to gently press it on your eye. We're not putting direct pressure on your eye, and we are not rubbing or scrubbing your eye. Then we're going to wait 1 to 2 minutes. We're going to pretend 1 to 2 minutes has passed. Okay, 1 to 2 minutes has passed, and now the crust has softened. So we are going to wipe your inner canthus and your outer canthus. Perfect. Now we're going to do it with the other eye. Gently, 1 to 2 minutes. 1 to 2 minutes has passed. And then we are going to wipe your inner canthus and your outer canthus. Perfect. You're doing so well, Mr. Smith. All right. Okay, so the next thing we're going to do is we're actually going to administer the medication. So I'm going to perform hand hygiene. And then I am going to don clean gloves. All right. So for this, I am going to lower your bed. You're gonna lay in your supine position or the bed. Okay, so that means on your back, and then we're going to put one of the bed rails down. Perfect. Okay, and then I'm going to uncap this. Perfect. Okay, so what's going to happen is I'm going to use my non-dominant hand. Use my non-dominant hand on the side of your cheek, okay, like so, just below your under eyelid area. I'm only gently pressing, and I'm gently pressing down just to expose your conjunctival sac. And I'm going to use my dominant hand on your forehead very gently, okay, not pressing too much, okay. Now before I administer this, please look up. Do not close your eyes, do not blink, because if it does not go into your conjunctival sac, I'm going to have to administer the dose again, okay? Okay, ready? I'm just pushing slightly down, exposing your conjunctival sac, okay? Look up, don't blink. 1, 2, 3. Okay, wait, hold it. I'm gonna push this on the side of your nose to gently press on your nasal lacrimal duct. Okay, we're gonna wait 30 to 60 seconds. We're gonna pretend 30 to 60 seconds have passed. And then you are going to gently close briefly and gently close your eyes. Okay, perfect. Okay, now we're gonna do the same to the other side. So, same with my non-dominant hand. We're gonna gently press on your cheekbone, not directly, just downward a bit, underneath your bottom eyelid. And now I'm gonna put my dominant hand on your forehead, 1 to 2 centimeters above your eye, exposing your conjunctival sac. I'm gonna count to 3. Look up, do not blink. Okay, 1, 2, 3. Okay, hold it, and then I'm going to press gently on your nasal lacrimal duct for 30 to 60 seconds. Okay, close your eyes gently and briefly, and there you go. Okay, you did such a good job. Okay, now I'm gonna sit you back up, pull the bed up, and then I'm going to put the bed rail back, and then I'm going to close this. I'm gonna close this, and I am going to throw this away. You did very good. Very good. Do you have any questions? Are you comfortable? Okay, that's good. I'm gonna put your call light next to you. If you need anything, please let me know. I'm gonna come back and check on you after a little bit, okay? But of course, your call light's here. If you experience anything, please let me know. And what else? Okay, I'm just going to perform hand hygiene again, and I'm gonna go document my procedure, but let me know if anything happens, okay? Okay, so perform hand hygiene one more time, and I'm gonna go document the procedure.